Hi, I'm Bashi with Saunders Speech and Voice. Today I wanted to talk to you about laryngeal massage. Your larynx is another name for your voice box. It's where your vocal cords are. It sits just above your trachea or your windpipe and is the very bottom of your vocal tract. When we're thinking about the larynx, we're asking it to do a lot just in everyday speech. It's moving, shifting, stretching, moving up and down, changing things about our resonant quality, allowing us to make our voice in a healthy way. At times when we're working with voice training, when we're working to shorten the vocal tract or keep the larynx lifted, or even when we're working to lengthen the vocal tract for masculinization and drop the larynx, keeping it relaxed to lengthen the vocal tract downward, we can sometimes create a little bit of tension. So knowing how to release some of that tension and just to give your larynx a little bit of love and kind of like a spa day for all the hard work that it puts in can be really helpful. So we're going to go over a couple different exercises. First of all, it's important to know that tension doesn't really like to go away. It just likes to go somewhere else. So while we're really focusing on releasing the larynx, we're also going to do a little bit of stretches and mobilization of some of the accessory muscles in the neck, the base of the tongue, and some of the submental muscles or the muscles underneath your mandible that also help to kind of lift the larynx. First things first, let's just do some slow head circles. So I like to think if the tip of my nose were a pen, I'm drawing circles with that instrument. So the first set of circles is going to be pretty small, like you're tracing a teacup saucer with your nose. You can go the opposite direction, just bringing gentle movement into that axis. And then you can open up the size of those circles to like a dinner plate that you're drawing with your nose. And the opposite direction. Also like to think about mobility of being able to look over your shoulder. You're not having to wrench through your range of motion or push, just going to the end of the range and kind of drawing a rainbow with your nose over to the other side. And again. And then we'll do that same kind of sweeping motion like we're grazing our chin across the chest. And back the other way. And then really feel into like what your body wants here. Like my body was like, hey, what about a little bit more to the left and the right? Just kind of letting these stretch out. A lot of times your body will give you cues. If you're feeling a tense point or a sticking point, you don't have to like wrench or crack or move through it. Just acknowledge where it's at. Let gravity, let your head fall to one side for that stretch. Don't have to go any further than that. We don't want to put the muscle into overstretch or strain it. Next, we're going to talk about some landmarks with the voice box or the larynx. The main place that you'll be able to notice is the thyroid cartilage, which is kind of like a shield-shaped piece of cartilage that comes to a point at the front and kind of shields your voice box from anything really happening if it were to hit it. So what you'll feel is kind of the tip or the very front of that shield. If you feel your Adam's apple or your Madam's apple, that kind of pointy tip to it, that thyroid prominence. So we're going to find that first. And if you're having trouble finding it, your larynx will move significantly when you swallow. So if you can see here, when I swallow, it really moves up and forward. So if you're wondering, do I have the right spot? If you swallow and you feel it kind of jump up and forward, you're in the right neighborhood. Find that tip of your thyroid cartilage. Then we're going to take 2 fingers and place it on either side. There's this flat space on one side and same on the other. And then just like that, you have your larynx at your fingertips. So you can lateralize it pretty far. Lateralizing being moving it side to side. I want you to focus here on just how far over it can move. And a really important preface is that nothing we do together should ever hurt. It might feel weird. The throat's kind of a sensitive part of your body. You might feel a crunch or a pop. That's totally natural with this side to side movement here. There's a lot of cartilages and fascia and adhesions that might be breaking up. But pain is not normal. So stop immediately if you feel pain, anything sharp that happens when you do this. So what we're going to do is move it side to side. I don't recommend talking during this. It'll be really hard. But just for your own awareness, I want you to just see how far over, how close to the midline of my face or of my chin I can move my larynx. So this finger might come all the way to midline or even further over. This is something you can breathe normally with. You just want to stay nice and relaxed. Reach the end of your motion with that, or reach the end of your range of motion with that stretch. You don't need to push any further. You don't have to push to pain. Just kind of acknowledging where your body's at and just giving it a little yogic stretch. So move it all the way to one side, hold for 3 or 4 seconds, and then bring it to the other like so. So I recommend doing 3 to 4 times to each side. Just see what you notice from there. This next exercise, we're going to find that same landmark, that pointy part, that tip of our laryngeal cartilage. And then we're kind of going to make a little crab claw and put it on either side and just massage in gentle circles. So you can go all the way down to your trachea or your windpipe, come all the way up and massage kind of these muscles near the base of the tongue and the submental muscles. Just a gentle relaxation massage. You don't have to go deep. It's not a deep tissue massage. It's not a sports therapy massage where you've got to get into a trigger point and really dig in. We're just adding attention, blood flow, and reminding these tissues that they don't have to be tense and constantly engaged. If this is uncomfortable because it feels pinchy on your skin, add a little bit of shea butter, coconut oil, some lotion, just something so that your hand can kind of slide over the skin rather than pulling or tugging on it if that's uncomfortable for you. The next exercise that we're going to do, or stretch rather, is going to be finding that same point. And then just above it, you might notice a little kind of divot or like a ditch, a little gap or trough. And what that is the space between the hyoid bone that your voice box hangs off of, kind of like a wishbone shaped bone up at the top here, and your larynx. So your larynx is suspended by a ligament between those two structures, your hyoid bone and your thyroid cartilage. And sometimes that space can get really tense. So what we're going to do now is sink into that space and give it a little massage. So find that landmark, that point, go just above it. And sometimes tilting your head back and yawning will really open that up. So if you're having trouble finding that gap, just yawning, tilting your head back, you'll feel it open up. Make an even smaller crab claw, yawn, find that space, and then just gently sink your fingers in. For me, I can't get my entire finger in there, just my fingertips, but I'm just trying to find that little bit of space and give it a little back and forth massage. Staying really relaxed, letting the jaw fall slack. Opening up a little bit more. From here, and this for me is one of the less comfortable ones. It's not painful, it just like doesn't feel great at first. For me, what I like to do here is yawn again to open that space up, and then I'm gently gonna pull down on that space. So we're just kind of stretching that ligament a little bit. So a gentle pull. If you feel a click or pop here, unlike the lateralization one, here that is not normal. So comment or let me know if you're experiencing that. But we just want a nice stretch for about 5 seconds. Doesn't have to be a super far movement, and then relax from there. Next thing we can think about is the jaw, and as well as the base of the tongue and the muscles underneath the chin. So sometimes just like a little pokey massage here can be super helpful. For my transfem clients, sometimes the space is like rock hard because they are bringing their tongue forward, keeping their larynx lifted, engaging these muscles really constantly, and they're just in overdrive. So a little massage with your thumbs like so, or with your fingers like this, to kind of create some softness and movement there can be really helpful. The jaw as well. Sometimes with transfem clients, keeping the jaw a little bit more neutral for that brighter sound can create some tension. And then also for my transmasc clients, sometimes they just have general tension here and difficulty kind of opening things up a little bit for that more relaxed, like cavernous, booming resonance. So if you kind of feel the edge of your jawbone here, you'll feel this like really meaty piece of muscle here. It's like that main kind of chewing muscle. So I like to just do a little bit of a pull down from kind of like just below my cheekbone here down to here, letting the jaw fall slack. Again, it doesn't have to be a lot of pressure. A lot of times to break up like fascia or get things moving, you don't need a lot of pressure. Gentle is good. So those are just some general massage techniques. I recommend doing these before, after voice training. Sometimes preemptively it's great if you are suspecting you might be kind of clenching or tense generally. After voice training, if you're experiencing tension, it's a great way to kind of diffuse it. I'd stay curious about what kind of effect you notice. If it's really helpful in reducing tension preemptively, awesome. If it's really helpful in diffusing it after, good to know. Ideally, we want to be changing the way that we're doing things in the first place to avoid tension, but sometimes it's just helpful to have something in your toolbox to diffuse it.